Welcome to the Deep Dive. Today we're taking a really practical look at hormonal health. We're digging into a guide from Blood Test UK about the testosterone blood test, and we're focusing specifically on Nuneaton. Why getting this test done close to home is actually a pretty smart move. We want to figure out how this little test can help you feel better, and why doing it nearby is just super helpful,
Exactly. The idea is to break down what the test actually shows the level of testosterone in your blood, and crucially, how that helps doctors figure out things like maybe why you've got low energy or mood swings or perhaps low libido. The clinical term is hypogonadism.
Okay, let's unpack that. The Blood Test UK guide seems really keen on this stay local idea. So why is getting this test specifically in Nuneaton such a benefit, according to them? Is it just about saving a bit of travel time?
Well, that's part of it, sure. Less driving, maybe lower costs overall. But the interesting thing Blood Test UK points out is how convenience links to faster action. Better follow.
Faster action, how so?
Think about it. Getting results quickly. The guide mentions local places, George Eliot Hospital is there, but also various private clinics listed in the Blood Test UK database. Some of these clinics might offer results, potentially in like 48 hours. That's much faster than waiting weeks, maybe.
Ah, okay. So speed is a big factor. And that speed means you can talk to a local doctor sooner.
Precisely. You get those results, you see a local GP or specialist, someone who, understands the local health landscape. That leads to more personalized care, quicker treatment plans if needed, and the cost. Blood Test UK suggests it's generally manageable, maybe somewhere between, say, £50 and £150 for the test itself.
Right. Makes sense. Connect the dots for us then. What does this test actually find? What are the benefits of knowing your level?
So the test is looking for hormonal imbalances, specifically low testosterone or low T. Low levels can cause all those things we mentioned, low energy, mood shifts, sexual function issues. But Blood Test UK also flags something important: early detection. Finding out early can help avoid bigger problems down the line.
Bigger problems, like what?
Well, for instance, chronic low T is linked to things like reduced bone density, osteoporosis risk. That's often silent until much later. So this test, it's kind of an early warning signal for your overall health, not just how you feel day to day.
Got it. So it's pretty important. What about actually doing the test? The guide on Blood Test UK mentions preparation. How critical is that?
Oh, it's absolutely crucial for getting an accurate reading. The test itself is just a simple blood draw, usually from your arm, quick. But the prep, that matters. The guidance often suggests fasting maybe 8 to 12 hours beforehand, just water allowed.
Okay, fasting. Anything else?
Definitely. You absolutely must tell your doctor about any medications or supplements you're taking. Things like statins, for example, can potentially affect hormone levels and skew the results. And avoiding alcohol or certain supplements right before the test is also usually recommended. You want the truest picture possible.
Right. Okay. So let's wrap this up for someone listening, maybe in or near Nuneaton. What's the main takeaway here? It sounds like knowing your testosterone level is, pretty key for your overall health.
Yeah.
And using local testing options, like the ones Blood Test UK highlights for Nuneaton, just makes the whole process smoother, faster, easier.
Exactly. It streamlines everything from getting the test to potentially starting treatment if needed. Less hassle, quicker answers. But that brings up a really important point, actually. This isn't usually a one-and-done thing. Hormone levels aren't static. They change. They fluctuate naturally, day to day, and definitely over the years. So Blood Test UK generally suggests regular monitoring, maybe every 6 to 12 months, especially if you're managing levels.
Consistent checks then, not just one test.
Right. It's about establishing your baseline and tracking it. Taking control of your health often means keeping an eye on things consistently. And that leads to a final thought, maybe something for you to consider. If your hormone levels can shift significantly in just 6 months, what other important health markers might be changing quietly without causing obvious symptoms yet?